Let us just get into the case presentations. I'll be showing you the most common symptoms the patients do present to us and how we deal with them. So, this is a case of a 40-year-old female. A 40-year-old female patient presented to our hospital with the complaints of one-sided facial pain. She was a COVID positive patient and she recovered from COVID 20 days ago. She was admitted in the hospital, and as she was having difficulty in breathing and her oxygen saturations were low. She was given some antiviral medication, antibiotics, some steroid medications in order to prevent some from further complications, and she was safely discharged from the hospital. Now, since for the past 2 days, she has been experiencing nasal block and has facial pain on specifically more on the right side. She is a known case of diabetes and hypertension since 5 years. So, this would be a typical case presentation seen in most of our patients presenting to us right now with the myocardmycosis. And that's why I just put forward this case so that you can just correlate. So, when a patient visits to us with these symptoms, how does an ENT surgeon investigate? So, how do we proceed now? After taking a proper detailed history about the COVID status, the medicine she has been using, her comorbidities like diabetes, hypertension, was she on any thyroid medications, etc., we proceed with the ENT examination proper in our outpatient department at first. So, this is how we do it. We start with our routine ear, nose, and throat examination. And this is me who is sitting in my OPD room, and the one who is sitting opposite to me is not a true patient. She is my OPD staff. She just volunteered herself for being a practice patient. I placed this video specifically because just to make you feel that you're truly shadowing an ENT surgeon, and hope this helps out. This is how we do a physical examination. We put on the headlight. This is basically me putting on the headlight, and we examine the nose with the help of a nasal speculum. That's a Tudicum nasal speculum which I am using, and this procedure is called anterior rhinoscopy. We check the nasal cavity. We check the color of the nasal mucosa. Are there any crusts which are seen? So after this, we place a tongue depressor and we check the throat, the oral cavity proper. And we also make sure that we check the hard palate in order to check any signs on the palate, such as some blackish discoloration or ulceration. And then we also check the ears and the post-oral groove on both the sides. This is the most important part, what we check for right now in cases of mucormycosis. We check for the paranasal sinus tenderness. This is how we check. We check for the maxillary sinus by palpating over the cheekbones, and that is how we check for the frontal sinuses which are present above the eyes, and also the ethmoidal sinuses which are present in between the eyes. So after a thorough ENT examination in our OPD, if we find something suspicious, then we proceed with the nasal endoscopy. In the nasal endoscopy, we check for once again, the color of the nasal mucosa, how are the turbinates or the flesh which are present there appearing, and are there any discharge or crust? And this is how we do. So before I show you how a diseased nasal endoscopy looks like, let me show you how a normal diagnostic nasal endoscopy appears to be. So here we are passing the endoscope through the right nasal cavity. You can see the inferior turbinate, the flesh, and we are advancing the scope even more further, and that's the choana, the posterior nares. And we are advancing it even more further, and that's the nasopharynx. That's the area where the nasal swabs for COVID-19 were taken. This is the nasopharynx. And this is the eustachian tube, a tubal opening, in fact, into the nasopharynx. This eustachian tubal opening, it connects to the middle ear via the eustachian tube. And Now we are coming back, and this is the most important structure, the middle turbinate. And these are the openings lateral to the middle turbinate, and those fine hidden openings are the openings of the maxillary sinus, the frontal sinus, and the ethmoidal sinus. So this is how a normal endoscopy looks like. So this is the endoscopy of the patient who is having myocard and this is our first case scenario. I have placed a normal endoscopy picture here for you to compare. So this is the middle turbinate, a normal looking turbinate. The middle turbinate on the right side nasal cavity of this patient is completely blackened and it is completely avascular. You can appreciate that. You can also see thick black crust overlying it, indicating it is undergoing very bad necrosis, gangrenous condition. And the middle turbinate on the left side in the left nasal cavity is also losing its blood supply and becoming avascular, but not so much right like the right side nasal cavity. It is in its early stages. And you could also see blood-stained discharge or blood-stained mucus, which is draining into the nasopharynx or the posterior ends of the uh, uh, nasal openings or the choana. So this is one more case scenario. Once again, I placed a normal endoscopy picture here. This is nasal endoscopy of one more patient. In this, the middle turbinate on the right side nasal cavity is perfectly normal. It looks absolutely normal. And the inferior turbinate, right inferior turbinate, is also absolutely normal. That is how it is supposed to look like. And on the left side, you could see that the entire middle turbinate is completely covered with a black eschar. So this is a very characteristic of mucormycosis in its early stages. And you could also appreciate that eschar being spreaded to the inferior turbinate of the left nasal cavity also. So the gangrene has started and it is extending within the nasal cavity. This is the case scenario to this. I've just placed patients who are presenting to us very early, not very gross situations. So if patients present to us in this early situation, the prognosis will be really, really good. So this is a case scenario 3. It's one more case scenario. So once again, I place the normal endoscopic picture on the corner. This is the middle turbinate, which is seen on the right nasal cavity. You could see a cobblestone appearance, which is seen in cases of early mucormycosis. And you can also appreciate a bit of color change than the normal mucosa, how it appears like. So this blackish color is seen on the right nasal cavity. And the inferior turbinate is good. It's a pinkish mucosa. It's just very well maintained. But on the left side nasal cavity, you could see it is once again completely covered with a black eschar. And it is surrounded by mucoid discharge, mucoid nasal discharge. So this is once again an initial presentation of mucormycosis where it is being limited to the middle turbinate area itself. And the left side inferior turbinate is once again absolutely normal. So it is just limited to the middle turbinate area itself. So this is case scenario 4. And once again, I place a normal picture on the corner side. And on the right side nasal cavity, once again, the classical cobblestone appearance is seen on the middle turbinate. That's what you're able to see. And you could see this a black crust underlying it onto the inferior turbinate specifically. This is specifically seen once again in the early stages of mucormycosis. And on the right inferior turbinate, you can see that it is covered by a white fungal slough. Okay, this is very well appreciated, I guess. And then on the left side nasal cavity, this patient had polypoidal nasal discharge with pus which is being outpouring from the middle meatus area. There was no as such black crust which is seen on the left nasal cavity. So this is the case scenario 4. This patient presented to us early itself, but it's not quite early, I could say. This is the endoscopic picture, and you could see that the middle turbinate on the right side was normal, but on the left side, this patient had black to red colored eschar with some amount of blood stain discharge. And when we advance the endoscope further, we could see that the ishkar is being spreading to the middle turbinate also completely behind. And this is the hard palate of the patient, of the same patient. So the hard palate diagrammatic representation I've given over there, and this is a true patient where you could see some ulceration over the hard palate. These are once again the early signs we ask the patients to check for. If you find any ulcerations or color changes in the palate bone. So hence this examination of the palate is also quite important other than the nose also. Coming to the next case scenario, you should remember that not all the fungal sinusitis are mucormycosis. They could be caused by other fungus like aspergillosis, etc. Also, so on the right side, this patient had abnormal polypoidal growth with some pus which is outpouring from that. On the left side, it was nearly normal. This particular patient, I want to just extend on this particular patient. He was diabetic since 15 years, and on MRI and the CT scan, he was diagnosed with fungal sinusitis. So we did a surgery on him, and after the surgery, on we sent the specimen for biopsy and also for fungal culture. And the fungal culture turned out to be aspergillus. It is fungal sinusitis, but it turned out to be aspergillus, and this is comparatively less invasive and is pretty much seen in most of the diabetic individuals. So it's really important not to just rely on the MRI, CT scan, and the nasal endoscopy picture. We make sure that, and there is a clear emphasis that we need to send this for fungal culture and identify the type of fungus causing it, because the entire medical management, the post-op management completely varies with the mucormycosis and other fungal management. And always remember, or not all fungal sinusitis are caused by mucor fungus. So that's what I want to stress on this endoscopic picture of the patient.